Hi friends, this is your friend Faith Enriquez coming to you live today from Grove City, Pennsylvania. I want to thank you for taking the time to watch my videos the last few days. If you missed any of them, they are all here on my Goodbye Concussion Facebook page. If you missed them again, video 1 was entitled, Do You Want Your Life Back? And in that video, I talked about how my daughter Maria, who was very, very sick 3.5 months after her concussion, how we ended up in the doctor's office of a world-renowned concussion clinic in Pittsburgh, and with Dr. Collins there, and how he told her that if she did what he said, that she would get better. And what a surprise that was to hear such a confident word of hope. And we learned in that video how Dr. Collins taught us that there are 6 different types of concussions. And if you diagnose and treat those concussions, they're treatable and you can get better. Our second video, we talked about the transformation that Maria experienced, how she went through surprising, very surprising, and effective treatments for her concussion. She was taken out of her dark room, told not to rest. She did targeted, active treatments that got her 100% better. And not just her, but that there are tens of thousands of people who have been through these treatments at UPMC and have gotten better. And not just at UPMC, at other similar places all over the country and even all over the world. Our last video, we talked about finding good care. That's all very nice for Maria and people who live near or can get to Pittsburgh. But how about you? How can you find good care? Well, I talked you through and guided you through in the video 3 how to go about finding good care. What does the care look like? There's a directory of doctors and physical therapists and clinics that you can consult and find a place that's close to you, of people who are at least familiar with the Pittsburgh method, I call it, of how they treat concussions there at UPMC. And also I gave you a kind of a checklist, a cheat sheet of what you should be looking for from your concussion doctor. Try to check all those boxes off. Call around. Look on the websites. Try to figure out who's the best option near you, who's really going to give you good, targeted, active treatments. Now, today's video has a big title. I call this one Hope for the World. And I talk to concussed people every day online, and so many of them, as frankly I did just about a year or 2 ago, don't believe there's any treatment for concussions except rest. That's all they've ever been told or ever heard, is that's all you can do if you have a concussion. Just go home and rest, and hopefully it will get better. Most get better in a couple weeks. Oh, sometimes it takes a lot longer, but really there's nothing you can do. These people, and I myself, had no idea that effective concussion care even exists. Never mind where to go to find it. Well, let me give you today a picture of what good concussion care looks like right from the beginning if someone gets a concussion. If you watched my first video, you saw this photo of my beautiful family, and we talked about how 4 of these, let's get them all in here, 4 of these children of mine all had concussions where symptoms lasted for months and months and months. And thankfully, they all did eventually get better. Maria got better the fastest, because after 3.5 months of just worsening symptoms, we ended up at the University of Pittsburgh Medical Center, and she got good treatments and she got better. But I have one more son here who got a concussion, and that is Josiah. Let's see if I can get in here and point him out. He's right on the end here, Josiah. So just a couple months ago, this past January, Josiah was at wrestling practice, And another player, Josiah was resting against the wall. Actually, he had hurt his knee. He had an ice pack on his knee, was sitting against the wall. And another player had a barbell and was just curling the barbell. And this player backed up and somehow managed to hit Josiah in the temple with the edge of that barbell, cracked him right in the side of the temple, gave him a bit of a cut and everything. So the athletic trainer called me right away. The coach actually said, Josiah, take that ice pack off your knee and put it on your head, which was pretty funny. But the athletic trainer called me to say they were afraid he might have a concussion, and they had him sitting out. When I talked to Josiah soon after, I knew right away that something was wrong. He was uncharacteristically irritable and indecisive and sad. He was not himself. I knew something was wrong. So the very next morning, I called up Dr. Collins' office and got an appointment for Josiah to be seen just 3 days later. Josiah went to Dr. Collins' office down in Pittsburgh and got the full assessment that they do down there. And Dr. Collins discovered that Josiah had an ocular problem. As he was, a target would be coming into his eyes. Your eyes are supposed to converge together to keep whatever object is coming toward you, keep your eyes focused on them. They work together and almost they kind of start to cross is what they're supposed to do. But one of Josiah's eyes was popping out instead of staying together and working as a team. I've talked to people online who have not had that problem diagnosed for 18 months, 2 years after their concussion, because their doctor just doesn't know to look for it. Josiah had that diagnosed within days of his concussion. That being hit in the head there had somehow knocked off that system in his brain, that his eyes needed to learn to work together again. He was also diagnosed with a little bit of vestibular problems. The vestibular system, again, is the part of your brain that interprets motion, both your own motion and motion going on around you, and just a bit of anxiety and mood kind of issues of concussion too. So Dr. Collins and his team set right to work actively treating those problems. Josiah was sent to physical therapy there with Dr. Ann Muka, the top physical therapist there in Pittsburgh. She had him doing exercises, training his eyes to work together as a team. She gave him exercises to take home that he had to do every day together at home. We would do these exercises. He did some by himself, but some involved another person. We actually have a video of him and me and our dog doing one of his exercises here on this page. Well, after 3 weeks, Josiah was better. That was all it took. 3 weeks of targeted active treatments. He was able to take the exit test at UPMC. They have everyone, before you are dismissed from their care, you have to pass a very vigorous physical exam. They basically make you do everything that could possibly give you symptoms, whether that's running at a high heart rate, spinning around, catching balls, large dynamic movements, jumping, all kinds of things like this that if somebody had a concussion, it's going to bring on symptoms. They make you do all of those things without getting any symptoms. If you can pass that, along with cognitive tests and some visual tests and other things, then you get released. Josiah was released there just 3 weeks later. And seeing Josiah go through that and the difference between that immediate good care compared to my sons and so many other people I talk to who just stumble around for months or years without finding good care, really made me think that about this treatment that he was blessed to receive. And it made me wonder, and why can't everyone in the world get treatment like this? Did it take a long time for him to get an appointment? No. He was able to be seen just a few days after his injury. Did he get effective treatments? Yes, he did. The doctor and the therapist figured out exactly what was wrong and wrote exact prescriptions of exact exercises to do to target his precise problems. Did we have to bounce around from doctor to therapist to this other doctor, trying all kinds of different things? Which is what happens to a lot of people. They say, well, I'll try some vestibular therapy. That didn't work. Well, now let me try some vision therapy. Well, that didn't work. I'm feeling like maybe I have some emotional issues. So let me, try counseling. That didn't work. No, we did not bounce around from thing to thing to thing. All of the care was administered in a cohesive, organized fashion, all overseen by Dr. Collins and a team of experts, all working together to address all of Josiah's issues all together in the right order, in the right way. Did it require expensive imaging equipment? No, it did not. UPMC has expensive imaging equipment in their concussion lab, but the ordinary person who just visits there with a concussion, they do not receive expensive imaging tests because it's not necessary. Josiah's diagnosis involved a laptop computer, a popsicle stick with a little letter written on it that they could pull towards his nose, some just basic physical therapy equipment like medicine balls and cones and things like that. There's nothing about this treatment that is expensive, that requires a lot of money or equipment. Did it drain our life savings for him to go there? No. The total cost of his treatment was about $1,000. And for us, that was mostly paid for by our insurance. But even if it had not been, it was a very reasonable cost for a recovery. Did it require doctors with expensive neurology degrees? The answer to that is also no. The head doctor at UPMC, Dr. Collins, he is a neuropsychologist, but he's seen his kind of program overseen quite successfully by physical therapists who have access to a team of specialists as needed. You don't have to be a neurologist in order to administer this kind of treatment. There's nothing about this method that should hinder it from being made available to everyone, everywhere. That is what I strongly believe. And I believe that you can have Josiah's concussion story too. If, like he did, you can get good treatment right away. UPMC has a recent study showing that if you are treated within the first, I believe it's 7 to 10 days, that your recovery time is much, much faster, average of about 3 weeks recovery time if you're seen right away. So you can get Josiah's concussion story if you can get good treatment right away. But as I talk to, again, many people around the country, they are not getting good care. They don't know where to look for it. They'll maybe take months and months and months and finally be seen by a neurologist. And they're so hopeful. They'll say, I'm so happy. I'm finally getting to see the neurologist tomorrow. And then the next day they'll come back and say something like this. I'm going to read a direct quote of what someone said about their trip to a neurologist. This is the conversation. Neurologist, well, you look fine. Patient answers, thank you, I don't feel fine. The neurologist says, well, you should be fine by now. The patient says, but I'm not fine. That's why I'm here. And the neurologist answered, I don't know what you want me to tell you. The patient just said, I just want you to do your job is what I want. And the neurologist had no answer to that, just sat there blinking, just didn't know what to do to help this concussion patient. I don't want you or anyone else to settle for that kind of a conversation. Instead, I want us all to join together to see effective, affordable concussion care made available to the world. In order for that to happen, as I thought through this, I thought there's three groups of people who need to hear this message that concussion is treatable. And those three groups are, first of all, just ordinary people, patients, parents, people who have a concussion or know someone with a concussion, need to know that that affordable and effective concussion care exists. Like I said, most people, or at least many people, have no idea that there even is such a thing as treatment. So that's our first mission, is to just get that word out there that there is treatment for concussion. Concussion is treatable. The second group of people who we want to get this message out to is first-line medical providers, people like family doctors, pediatricians, athletic directors at schools, emergency room, people like this who are the first-line providers. Somebody gets hit in the head and they end up in these people's office. Well, these medical professionals also need to know that effective, affordable concussion care exists. And they need to know to tell their patients right away, get them plugged in right away with good treatment. Many times, I know even for my children, they were told to go home and rest. And maybe a couple weeks later, the doctor would say, okay, it's been a couple weeks now, you're not better yet. Let's see if we can find some, physical therapy or something else to help you. But no, we need to get that message out that as soon as a concussion patient shows up in your office, send them right away to a specialist who can figure out what kind of concussion they have, what kind of help they need, and get them started on treatments so that 3 weeks later, they're better. Not, oh, now it's 3 weeks later and you still feel horrible. Well, let's now see if we can get you some treatments. So that's our second group we want to educate, is medical providers. And the third group who we want to provide training, we want to get a message out to, is medical professionals who either are already treating concussions or who think maybe someday they would like to become a concussion care specialist. Those kind of people, they need good training. They need to have access to the methods here that have been pioneered by Dr. Collins and UPMC and many other fine research places around the country that are putting out a lot of research about targeted active treatments for concussions. We want to see these methods, this idea, put together into a cohesive, thorough training that can be provided to medical professionals who that would be useful for. So that is something that is a future plan that we have, is to get something like that put together, or to facilitate that somehow. So this is, and as I thought about those three groups of people who need this message, it was interesting because I had thought that out. These are the three people we need to target, the three groups we need to target. And I actually mentioned it to Dr. Collins himself as well, as I was in his office with my son Josiah, and he agreed. And then later I read Dr. Collins' book. It's called Concussion. But right towards the end, where he's talking about how to change the culture around concussion and how to see a growth in concussion specialty clinics, he and his co-author basically say the same thing, that as awareness grows among ordinary people and among first-line medical providers, that creates a base then for good concussion clinics to spring up or to improve all over the country. So this is a big vision, I'm talking about hope for the world. So how do we make this happen? So I'll say first of all, thank you to Dr. Collins and his team at UPMC. They're doing everything they can to work from the top down because that's where they are. They are at the top. They are um, top respected concussion care experts leading the field in the world. Dr. Collins and his team, they speak all over the world at conferences. They have worked with the international consensus statements in Berlin. They've worked with the CDC and the National Institutes for Health. They work with the NFL, with the military, with the MLB and national college like the NCAA. They work with all these top level people trying to get the message out that concussion is treatable and that this is what you do for players or people who have concussions. So he's up here working at the top. But there's all of us, you, me, our neighbors, our friends, our kids, the kids on our kids' teams, people in our schools, all of us down here on the grassroots. What we want to do is we want to start from the bottom up, building awareness around concussions, that there are treatments for it. You don't have to go rest in a dark room. You don't have to have symptoms that go on for years or forever. No, get treated right away. So the first, I just want to say again too, the first thing to change the world for you, if you have a concussion, please get yourself, or if it's your child, get yourself good concussion care. If you have questions about that, please ask me. Comment on my page, send me a direct message. I'll do everything I can to help you get set up with good concussion care. But once you've found concussion care and you want to help tell everybody else about it, what can we do? The first thing I did at my husband's urging is I've written a book about concussions. And I first wrote a kind of a big book, and then we said, no, you know what? We need something that's just small and bite-sized that somebody can just read in a half hour, that they can read quickly, that they can pass out, something small and just that says the basics. So we're just about ready to put out this book. Today is May 25th, 2022, and it should be available on Amazon in just the next day or two. The name of the book is Goodbye Concussion, and I'll see if you can see this. This is like a mock-up of what there you go, of what the title cover is going to look like. Goodbye Concussion. This is going to be available on Amazon. It's also going to be available for free, 100% for free, forever, as a PDF download on our site, www.goodbyeconcussion.com. The idea here is that we want wide distribution. It's on Amazon so that people who want a physical copy or a Kindle or an Audible have access to that. But like I said, it's for free as a PDF download on our site. In the book itself, towards the end of the book, we have a page that looks like this, little scan codes that you can cut out, put in your wallet, and pass out to anybody who might be interested in that book, because that scan code will take you to our website and to the free download page. We want people everywhere to have this information, that concussion is treatable. So that's the first thing you can do, is you can get a copy of our book once it's available. Keep an eye on my Facebook page here and we'll for sure let you know, or just go check Amazon the next day or two, or our website, and it'll be on there. The other important thing that you could do is to join our mailing list, because there's only so much that one person like me, or even one person like Dr. Collins, there's only so much he can do. He's only one person. I'm only one person. UPMC is only one clinic. As influential as they are, they're one clinic in one city, and their reach can only go so far. But if all of us can join our forces together to get the word spread out, if all of us can tell our doctors, if all of us can tell our friends and they tell their doctors, if all of us can be looking out for people who are possibly interested in becoming a concussion specialist, and get those people together for good training and help facilitate good concussion clinics being available, being made, created, or being made better in every city and town around the world. We can do it if we work together. So we don't have to wait for these big people at the top, like the international consensus statements in Berlin, to officially, make this the word and trickle down through all the medical fields. I mean, that's happening. It's happening slowly, but we don't have to wait for that. We as consumers can say, this is the concussion care that we want. We can go ask our doctor, this is what they're doing at UPMC. I've read all about it. It works. Help me find care like this. We can go to a physical therapist and say, I want you to do this screening on me. Look for my vestibular issues. Look for my ocular issues. If you don't know what that means, let me show you some training videos that the top concussion experts in Pittsburgh have put together. We can spread the word together. We can make this available to everybody. You can take back your life. You can help everyone who has a concussion to take back their life, to get good care right away. If you like what I have to say, I encourage you to please like this page, follow this page, share this page, share this video with anybody who you think might want to get on board with our movement to change the world and make concussion no longer a national crisis, that it would be. My vision for concussion is like this. I compare it to a broken arm. Shortly after my daughter Maria was healed and cleared from her concussion, another daughter broke her arm quite badly, both bones in her forearm. This poor girl, she had to get both of those bones set 4 times. She just kept having complications, and then finally when it healed, it broke again, and she broke it again. But broken arms are no fun. But do we sit around being afraid of broken arms? And say, no, I'm not going to let my child play sports because they might break their arm. Or no, I'm not going to ride my bicycle because I might break my arm. We don't sit around here and fear broken arms because we know that they are treatable. If you break your arm and don't get treatment, well, that's bad news, and that would be something to be afraid of. But we are not afraid of broken bones because we know that if it happens, it's sure not going to be fun. It's going to be painful and miserable for a while, uncomfortable, have to be in a cast and all that. But we know it's going to get better. And that's how I want concussions to be viewed. That's how I view concussions now. I sure don't want any of my kids to get a concussion, but I know that if they do, we're going to get good treatment right away, and they're going to get better. That is my vision for concussion care. Good treatment right away. People get better. Thanks for watching. Until next time, this is your friend, Faith, signing off. Goodbye.